I think we've known for quite a long time now about the potential of technology to encourage, enable and empower users of care and support services and their carers. I think the challenge has been to get action, to get traction on the ground, and I think the pressures that are now coming to bear on the system in terms of the funding constraints, in terms of the limitations on available workforce and indeed on the numbers of family carers are really bringing an imperative so that we must now move forward on this agenda.
People are now getting used to technology. The days when you think old people, they wouldn't dare touch it, you can forget that. The silver surfers probably know as much about it as anybody else, and are ready to use that. So I think we've got a different pattern, we've got people ready to use it, and certainly from the council's perspective, it's a very efficient way of delivering care.
Madeline Starr from Carers UK hit the nail on the head with the survey results that show so few people understand what care outcomes can be supported or achieved through using technology. It is about raising the profile of those things, making sure people are aware that there are apps out there, there's technology out there that they can use to help achieve an outcome, because it seems that lots of people just don't know that, and they're working really hard supporting their loved ones and people with care needs without using the advantages that are pretty readily available nowadays and can be bought or got hold of inexpensively and can deliver a great outcome. So it's about raising the profile and making people aware of what's possible.
I mean, obviously all councils are strapped for cash, so we do have to say, can we afford it? Well, we certainly can, and it is saving money, so that I have to recognise as one of the important factors, but also is it helping people lead better lives? And what are the users saying to us? And we're getting massive positive response from this. That's the real success factor. People lead better, more comfortable lives well into their old age.
So we've had a really successful event today. We've had about 150 people here from Hampshire County Council and from neighbouring authorities, from police, fire, health and so forth, talking about encouraging, enabling and empowering through innovation, using technology to help support people, help support carers. We've had the Dragon's Den Award for the winner, a fantastic idea to help people who are losing their hearing when they're having interactions with health and social care workers.
Well, my idea is called Read What's Said, and the idea is to take a smartphone or an iPad with a speech-to-text conversion app, and then convert that as speech as it's happening on a one-to-one basis, but also combining it with the likes of smart glasses such as Google Glass to be able to read the speech in real time, possibly with a slight delay, but essentially in real time, so that people with a hearing loss can follow what's being said and making it as natural and normal for them as possible.
A highlight of the day, I think, was Max and Arnav, 13-year-old, 10-year-old winners of PA's Raspberry Pi competition, coming and talking to us about developments they've created using the Raspberry Pi computer. Interestingly, following on from a Q&A session where we were worried about how we would achieve things in health and social care, and then you get a 10-year-old who comes on and says, look what I've made to help people who are suffering with dementia or perhaps at risk of falling. And then capped off with our celebration event, which is the first time we've done that. We thought after 4 years of huge success, we'd try and get people together who'd made a contribution to that. So we've had people from our installation team, people from the monitoring team, referrers, social workers who are involved in innovation, one of the champions, all recognised today for the great contribution they've made to making telecare and technology a really central part of the care offer in Hampshire. So one of the themes that's come through today was the way in which consumer devices are increasingly going to play a part in delivering care outcomes for people. And I think a great example of that is the work that we're doing with Amazon now, using Alexa, initially providing it to service users out of the box so they can familiarise themselves, get to use the services it comes packaged with, like being able to read the news or the weather or play music or ask quiz questions. A whole set of things that in themselves are quite helpful to somebody who may be suffering a little bit from isolation or just feeling the need to get easier access to information about what's going on in their area. But then on top of that, we're going to be working with Amazon to develop some new skills. One will be focused around the ability to remind an individual to do something, maybe take some medication, maybe hydrate, and another will be around helping answer the question, where's my carer? So we're really excited about that, and I think it's a really good example of how technology that's in everybody's house and everybody's pocket increasingly, providing a service that they want, whether that's music or news or whatever it is on their smartphone, but within that there is a service they need.